We begin with the Detroit Police Department beefing up its resources when dealing with people experiencing a mental health crisis. This comes as they're exploring other tools to prevent the use of deadly force during such encounters. Detroit Now's Andres Gutierrez has more from DPD headquarters downtown.
We bring you to custody. No. Come on, Scott. Scott, get in there. No. All right. All right, Scott. Bola, bola, bola.
You're watching the Bola Wrap in action, a handheld device that shoots a cord around a person's arms or legs, restraining them at a distance. It's one of the tools the Detroit Police Department is looking to invest in so there are safer outcomes in situations where someone may be experiencing a mental health crisis. Another one is the small robotic camera that they can toss into a scene.
Oftentimes we find people in crisis only want to interact with one person, but we can't put that person close to them enough to have that interaction. And so there's a bridge there with this new camera system.
It comes 2 days after Top Brass announced that they'll use these two other pieces of equipment in certain cases. One fires pepper balls, the other foam rounds.
We're not asking officers to bring a rubber bullet to a gunfight. That's completely unreasonable. But what we are saying is if there's an opportunity to reduce the likelihood of death and violence in the encounter, certainly we want to take advantage of it.
Chief White says his officers respond to about 17,000 calls each year involving mental health. That breaks down to about 6 each day. And so they're expanding the Crisis Intervention Team, CIT for short. Although there are more than 100 DPD officers who are CIT trained, there will now be 18 officers who will specifically handle calls that deal with mental health.
The call takers will triage, ask the calls. They will send it over. If it's determined that it is a mental health nexus, it will be sent over to our behavioral health specialist that's embedded there.
Our job is to make sure we take over the scene. We should re-engage the person that's in crisis, build rapport, build a relationship.
Keeping in mind that the individuals they encounter may perceive their surroundings differently, the CIT officers are changing what they wear. Chief, noticing the CIT officers aren't wearing the traditional uniforms. They have a softer look to them. What's the thought process behind that?
Well, the thought process is, and this is training and going through the training with our partners at DWIN, is that sometimes those who are in crisis identify the uniform as somewhat antagonistic, and looking at a softer uniform, a softer approach is something that we found could be a tool for de-escalation, and that's what we've done.
In Detroit, I'm Andres Gutierrez.